Need a hip replacement surgery? Meet Dr. Ishwar Bohra, a top surgeon who will guide you through the process and help you make the best choice for your health.
So hip replacement is the condition where your hip by any reason become damaged, where your hip cartilage is worn and torn. So in this condition, you need a hip replacement where your cartilage cannot be restored, your function cannot be restored, and it is always painful. You walk with the limping and your day-to-day activities compromised, then you are a candidate for the hip replacement. It is to replace the damaged socket and the damaged ball. So hip is a ball and socket kind of joint. So this socket and this ball, they both has to replace. You look at this model where you can look at the implant. So your socket is replaced with the metal shell and this femoral head is replaced with the femoral stem and the head. So this is how look like the hip replacement implant. So it become your normal artificial hip. After this COVID era, there is a rampant avascular necrosis is common because of the COVID antigen and the treatment of COVID, which include the steroids for many patients' COVID care. So that lead to the avascular necrosis means this blood supply to femoral head become damaged. So this become arthritic, where only the hip replacement is a choice. Hip replacement typically can be done in the younger patient as well. If your hip is damaged, so we don't hesitate to do hip replacement for younger patients even after age of the 20 years. Hip replacement typically lasts more than 25-30 years because nowadays implant and technology is so good that survival of the implant is almost 30 years. And this is same minimum invasive surgery with a small incision and with kind of ceramic and uncemented implant. Patient can do kneel down, patient walk, patient can play golf, swimming, all kind of activity except very high impact exercises which is not advised.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.